Good morning, everyone. We are excited to be here today. Welcome to the Stanford Healthcare Nurse Residency Program Application Preparation Webinar. My name is Christy Norris, and I am a Nursing Professional Development Specialist here supporting the Nurse Residency Program. This webinar is going to be recorded, and we should have the link available on our careers site in about a week. We provide you with that link a little later on in our program today. So we will also be having a Q&A session following this program presentation, and I will ask you to hold on to all of your burning questions in the chat discussion until that portion of the session, and then you will have an opportunity to start asking those questions. So by the end of this presentation, our hope is that you will be able to describe our application process and requirements, identify cover letter and resume strategies, and lastly, be able to recall the timeline, the departments that are hiring, and our program structure and curriculum. I would now like to take this opportunity to introduce the rest of the Nurse Residency Program team. Carrie Zoss is our Transition to Practice Coordinator, or Director actually, for the Nurse Residency Program. In addition to the Nurse Residency Program, she facilitates the Oncology Training Program, the Acute Care Transition to Practice Program, and at the Critical Care Training Program. Leticia Cortez is a Nursing Professional Development Specialist and Program Coordinator, and together we directly support the Nurse Residency Program. I'd also like to introduce Carly Dye. She is our HR Partner and Senior Talent Strategist supporting the Nurse Residency Program. I'm excited to share that today we have 3 of our current nurse residents joining this session. They are going to be able to share what made them successful in the application process when we get to the Q&A session at the end of this program. So before we jump into information on the Nurse Residency Program, I'd like to highlight who Stanford Healthcare is for those of you that might not be familiar with our organization. Stanford Healthcare is a large academic medical center with more than 300 facilities throughout the Bay Area. We are the only level 1 trauma center between San Francisco and San Jose. The Palo Alto Clinic campus alone has over 605 licensed beds, 100 ICU beds, and 53 operating rooms. Stanford Healthcare employs over 15,000 individuals, of whom 3,500 are clinical nurses. To get a sense of its footprint, the 500-P campus alone is over 800,000 square feet in size. There are more than 450 life flight visits annually, approximately 100,000 emergency room visits per year, and over 2 million outpatient visits per year. We are a large, high acuity academic medical center. Now on to the Nurse Residency Program. Our program is a recognized Vizient Nurse Residency Program since 2006. Our residency program is a nationally accredited transition to practice program through the American Nurses Credentialing Center. The American Nurses Credentialing Center sets the standard for residency programs that transition registered nurses into new practice settings. We are aligned with the Institute of Medicine's 2010 Future of Nursing report recommending for the implementation and evaluation of nurse residency programs. We also support the successful transition of newly graduated registered nurses each year into multiple clinical settings. Our overarching goal is our comprehensive 1-year program really is to develop that compassionate, dedicated, and smart individual who will make an impact in the lives of patients that we are in care of. So how we meet that goal is with our curriculum. We use Vizient's Nurse Residency Program curriculum. It was developed in partnership with our academic medical centers and the American Association of Colleges of Nursing during a time of need when nurse residents were leaving their role within the first year of their career. The goal of this curriculum is to support the new graduate nurse in their transition to practice, something that was needed then and still needed today. Our program integrates 3 principal domains: leadership, patient outcomes, and professional role. At a glance, you may notice in our curriculum that we don't go over system or disease processes as in nursing school. That's intentional because we don't reteach nursing school concepts or topics. What our program does is take all of your background knowledge, all of your skills, and your experiences, and then we build on those. We connect it all and how it would be applied in the clinical setting. So let's go over the domains beginning with leadership. So we discussed topics related to conflict resolution, patient care coordination, and the use of effective decision-making skills and prioritization. We talk about professional communication, and that not only includes the elements of clear and effective communication in the clinical setting, but also how to overcome challenges in communication. Lastly, we talk about resource management. When we discuss patient outcomes, we look at managing the patient whose condition is changing, and then how do you respond and not react? How do you integrate the patient and family in need of teaching? As mentioned earlier, we build up that knowledge and of the residents that come in, and we use their wealth of knowledge on what contributes to those patient outcomes. What's new for them is really applying those interventions to multiple patients with multiple acute and changing priorities. Whether it be pain management or infection prevention, we discuss on how to juggle all the new responsibilities with patient outcomes in mind. And then lastly, the professional role. Here we emphasize well-being. We are really proud of the content we've integrated in the program because not long ago, stress management and self-care wasn't something that we addressed. So we've listened to our residents and looked at the research to find ways to help the resident identify tactics and strategies to care for themselves, not only during the first crucial year, but long into their careers. We incorporate evidence-based research into the program. Nurse residents spend 5 sessions working in a group on an evidence-based practice project with a coach. That project will be presented at the end of the program to their cohort peers and their unit departments. We want to expose nurse residents to the many professional growth opportunities within the organization. We assist them with formulating an individual development plan, really asking what does the future hold for them? Where do they see themselves in the next 2 to 5 years? And then we provide exposure and information so the resident can then put themselves on the right path to achieve those goals. Program structure consists of clinical orientation, collaborative check-ins, program seminars, and an evidence-based practice project. So let's look at these just a little bit closer. The first category is orientation. Nurse residents will receive over 350 hours of clinical orientation with a trained preceptor. We use a tiered preceptor model, TSAM. Each tier builds on the previous. Essentially, it's a progressive, incremental skills acquisition model. The resident moves from simple to complex topics. So the nurse residents will start caring for patients in any given assignment, but their focus will be on certain aspects of the care, such as vital signs or assessments. Once the resident is competent in that tier, they advance and assume more responsibility, building on the previous tiers. The specialty area that the resident is hired into will determine the length of the orientation. Again, our goal is to safely transition the resident to independent practice. The second category is collaborative check-ins. We follow the nurse resident with supportive and collaborative check-in meetings over the course of the 12-month residency program. A member of the nurse residency team will collaborate with the unit leadership to follow the nurse residents through their program and offer support when and where needed. We celebrate successes and then we'll help to identify opportunities for refinement. When necessary, we'll come up with an action plan of support so that the resident can be safe and successful. The third category includes our program seminars. Seminars facilitated by the nurse residency program faculty. Again, not to reteach nursing school concepts. Instead, we integrate concepts that support the development and teach the nurse how to apply their knowledge and skills at the bedside. Topics include clinical reasoning, prioritization, communication, resource management, escalation, management or managing feedback, managing error, crucial conversations, and then we do a lot of teamwork and team building activities. We also engage in reflective journaling and we do large cohort debrief sessions. The fourth layer to our program structure is really around the evidence-based practice project. All residents are required to complete a group evidence-based practice project or EBP project. The EBP session supports the development of critical thinking and clinical reasoning skills. Project topics are aligned with the priorities of the organization and the specialty areas. Residents are supported by the nurse residency program faculty and clinical nurse specialist coaches throughout the project during work hours. The projects are presented at the end of the residency to the cohort as well as at the unit level. Depending on the type of project, though, it may be featured or presented in additional meetings within the organization. So as much as we want to recruit amazing clinical nurses, we also want to keep them and grow them within our organization. We understand that individuals want to continue investing in themselves through professional development opportunities, and that looks differently for different people. Stanford Healthcare is uniquely able to provide nursing with many opportunities for professional development. We are committed to growing and developing our clinical nurses from the moment they enter the nurse residency program and throughout their career. Once the resident has reached the 6th month of employment, they promote from a clinical nurse 1 to a clinical nurse 2. It's at this time that nurses have access to their tuition funds that can be used towards formal education opportunities. This can also be applied to your specialty certification if you're interested, continuing education. You may be interested in possibly attending or furthering your career in terms of a transition to practice opportunity. Maybe you're interested in critical care or the emergency department. So we can help to facilitate those conversations so that you know what you have available. And then mentorship is included and part of our residency program. So again, after the residency program, you may choose to continue with being a mentee or become a mentor yourself. This is a list of the hiring regions for our next cohort. A question we often receive is how many will be hired, and that always depends. The number of residents hired fluctuates based on the available positions within the organization. Currently, we don't have a set number, but we have the regions that will be participating. Stanford is a specialty hospital, so the specialty regions in this cohort include oncology, surgical, and medical AAUs, in addition to inpatient psychiatry and inpatient float pool. AAU may be a term that you're not familiar with. It stands for Acuity Adaptable Unit. What sets Stanford apart from other hospitals is our ability to adapt to the patient's needs. When outside of the critical care units, the AAUs can care for patients from acute care, so a 5-to-1 ratio, to intermediate care, or IIC, at a 3-to-1 ratio. So for example, if an acute care patient requires frequent intervention or monitoring and becomes an IIC or intermediate level patient, our AAUs are equipped to manage their care. Whereas other models, a patient with increasing needs may need to be transferred to another intermediate level floor or unit. The nurse's assignment can flex and stay within ratio to accommodate the patient's needs. It saves both time and energy while maintaining staff and patient satisfaction. The float pool serves the surgical, medical, and oncology AAUs. This is also where the training takes place. Depending on the needs of the organization on a given day, the nurse would float to that area in need. Our inpatient psychiatry unit is an inpatient unit here on the main campus. We'll talk about preference and specialty selection a little bit later, but I want to point out here that there are regions that have the most abundance of opportunity, such as the medical, surgical, and oncology regions, rather than the inpatient psychiatry or inpatient float pool. Psychiatry and float pool are hiring 1 to 2 residents in each specialty, so the opportunity to interview can be a little more competitive. I share this with you so that you can make an informed decision as to your preference on the application. This is completely up to you, but does warrant some thought. I'd now like to share the timeline for cohort 42. So we'll start with today. So today is October the 8th, and we are doing our application webinar. The application will open up and post on October the 21st and close on November the 3rd. So you'll then see we're going to spend the next approximately 7-8 weeks on application screening. And then save date, our interview webinar will be January the 15th, 2025. We will be hosting panel and unit level interviews beginning on January the 27th, with final offers to HR on February the 7th. And then the cohort start date is March 17th of 2025. One important date I want to highlight here, and that is starred, is the date in which you need to have your California RN license. That is February 14th, 2025. That is a hard and fast date for us. We need you to have the license by that point so that we can actually clear you in time for the cohort start date. So let's start talking about the application itself. Application requirements. So you must be a graduate of an accredited nursing program with your associate, bachelor's, or master's. We often get asked, can I apply before I graduate from my associate, bachelor's, or master's program? Or can I apply before I have my RN license? The answer to both questions is yes. Just keep in mind the date you must have graduated and obtained your California RN license by, and that's February the 14th, 2025. You cannot have more than 6 months full-time experience as a registered nurse. So when you break that down in hours, that's 1,040 hours, and that's by the start of the cohort. If you do, you are welcome to apply to a clinical nurse 2 position. Transcripts cannot be more than 18 months from the cohort start date. So that means that your transcripts cannot be older than September of 2023. Another question we get asked is, if I apply before, can I apply again? Yes, you can keep applying, keeping in mind the dates and information I have shared. So now you're probably wondering, what kind of documentation do you need? So let's go ahead and break that down now. So this is the required documentation you will need to submit your application. So first, we'll either need your official or unofficial transcripts. Be sure that your graduation date is not greater than 18 months prior to the cohort starting. So cohort starts in March of next year. 18 months prior to that will be September of 2023. We'll also need a cover letter and resume. In the resume, be sure to include all work experience, not just nursing related. If you participated in a nursing internship or externship, please include that. If you served in our military or have any volunteer experiences, please include those as well. The items listed in red are the areas we look at closely and score. We will kind of get into the application questions in a few slides from now. You'll notice we also list references. We are asking for a minimum of 2 references from clinical nursing faculty. So these are not your preceptors, but your clinical instructors that you worked with during your clinicals, your nursing clinicals. And then lastly, we're going to recommend that everything be uploaded into one PDF or Word document. This will help to prevent error. So your cover letter is a personalized introduction really to who you are. It allows the applicant to share with their potential employer their qualifications and interests in the position that they are offering. We use cover letters to get a sense of who you are and how you would use your experiences to accomplish the requirements of the position that you're applying for. You may choose to share why you pursued a career in nursing. What's motivated you? What have you done to get to this point? What makes you uniquely qualified for this role? So you have a culmination of experiences thus far, your personal experiences, your clinical rotations, your education, training, work experiences, volunteer experiences, military experiences. There's a plethora of them. And then why Stanford? What are you looking for in an organization, and what can you offer to our organization? How do your values align? And then lastly, what do you plan to accomplish in the future? So these are all suggestions on what you might want to cover in your cover letter. The main purpose of your cover letter is to really support the content of your resume. Your resume focuses on your qualifications, your achievements, and your past experiences. Your cover letter expands on those, really explaining how your personality and your achievements and really showcases all the work you have done. It gives insight into your soft skills, your attitude, and your motivation. With everyone coming in with similar education and training, really take this opportunity to shine and show your individual experience and achievements on what makes you stand out compared to others. So this is where you're going to want to slow down and think about what makes you uniquely special and why we would want to hire you. Some frequent questions that we get asked related to cover letters is, how long should a cover letter be? Well, that is entirely up to you, but 1 page will usually suffice. Who should I address the cover letter to? You can address the cover letter to the hiring managers of Stanford Healthcare. Does Stanford read each and every cover letter, or do they use some kind of software to scan for keywords? We read each and every cover letter. We read each and every everything. We do not have any software that helps us with any of this. Should my cover letter target a specific position or specialty area that I am interested in? And that is, again, up to you. It is not necessarily, but you absolutely can. Should I share my work experience, even if they are not related to healthcare? Absolutely. Everything relates back. Should I share my senior preceptorship experience, even if it was not in adult medicine? Yes. Tell us where you were and what you were doing. Should I think why it would be an asset to Stanford Healthcare, or does this come off as bragging? Share it. It's not bragging. We want to understand how hard you have worked to get to this point and what makes you uniquely qualified. So we get a lot of questions around formatting and what we want to see when it pertains to a resume. So let's walk through this example. A resume provides a summary of your experiences, your abilities, your skills, strengths, and accomplishments. It provides relevant information regarding your education, your experiences, and your job-related interests. It demonstrates what you have done in the past, which should align with the qualifications of the job you are seeking now. Think of your resume as your personal marketing tool that really allows for you to effectively and clearly communicate your assets to a potential employer. Listed on the slide is a sample resume. How you wish to display and format this is up to you, but this is one we chose, and everything listed on there needs to be on the resume for us to review and score. So, areas to score on the application for your resume: work experience, whether you've had an internship or externship, if you've served in the military, and any volunteer experience. Please ensure to include the number of hours you have volunteered for. We get a lot of questions about resumes and cover letters, particularly about format and length and what you should and shouldn't put on there. So if you think of a resume as an advertisement, it advertises you, your unique skills, and your qualifications. Keep it concise and be sure to include the areas outlined above. So in terms of how long a resume should be and what format you should use, the resume that we're sharing here is a great format. How you choose to do that is up to you, but do ensure that you're including all the information that you see, particularly in this order, is very helpful and very clean. How do I put the information in terms of clinical hours? So you can actually just put in a table, and then if you're still completing your clinical hours, you can put in progress. We'll get asked if we put certain points for attending certain schools or having certain GPAs. We do not. Do you give any extra points if you've had a clinical at Stanford Healthcare? No, we do not. However, if you did, please make sure to note where you did that and which unit specifically. It helps us to know with your specialty preference of choice and should you be considered for a panel interview where we might want to place you. Should I list non-healthcare related work experience? Again, yes, list it all because it all relates back. Is all volunteer work acceptable? Yes. What is considered an internship or externship? So an internship or externship, as it applies to this, is considered nursing related. It's outside of your clinicals and outside of your capstone. It can be paid or unpaid, and you would typically have to apply for this, and then there would be an end date. Should I apply with my RN license information? If you have it, yes. Should I provide my BLS or ACLS? It is not necessary on your resume. Should you move through the panel level interviews and then be offered a position through HR, you will be asked for these documents. And then can I list any other elements on my resume, such as your skills and certifications and accomplishments? Yes, you absolutely can. However, we will not look for you to upload any of those, and we will not be looking at those in your application. In your application, we are only asking for your transcripts, your cover letter, and your resume. So you may be wondering about the application itself. So let's discuss this. So you're going to be asked some demographic information. You will be asked, where did you hear about this position? Will you be willing to commit to a one-year residency program? That you understand that you will need to have your California RN license by February the 14th of 2025. Mostly all yeses and nos. You're then going to have the opportunity to list the areas you would like to work in order of your preference. So we try to place people in their top choice. Depending on how quickly a specialty interview panel fills up, we may look at your second or third preferences. If you have a passion for a certain area, I would say select that area as your first preference. If you're unsure and are open to different areas, keep in mind that there will be more departments interviewing within the medical, surgical, and oncology regions rather than inpatient psychiatry and inpatient flow pool. And those departments are smaller. The opportunity to interview is more competitive, meaning there will be less departments looking at you. A question we get asked related to preference selection is, will I only be given one opportunity to interview in my preferred area? Yes, you will only be offered one opportunity to interview on a panel. On the electronic application, you will be required to answer 4 questions. Each question has multiple components. You will be required to answer all components of the question. The length of the answer is up to you, the applicant. We accept all answers regardless of length. So we're going to go over the application questions shortly. So we have mentioned about the items scored on the application. The next portion of the session will be important for you. Application questions have a great impact on the scoring of your application. So a couple more recommendations before we get to those questions. So with regards to the application itself, we want you to ensure that all of the areas of the application have been thoughtfully and thoroughly completed. So again, this is going to be one where you're going to want to slow down and think about the application itself. Make sure you have completed everything. Make sure everything is uploaded. Put it in one document so that it's not confusing. Ensure your required documents are in a PDF. Again, that's a cover letter, a resume, and official or unofficial transcripts. Applicants who do not submit the required documentation will not be considered, and their applications will not be processed. Another recommendation is that you create an account. This enables the applicant to go back after the application has been submitted to ensure all documents have been uploaded, and you'll have the ability to follow your application status. It may take up to 24 hours for your application and documents to be routed and viewable. If after 24 hours you do not see your documents, you may email newgradrn@stanfordhealthcare.org with your documents no later than 11/6 at 5 p.m. Pacific Standard Time. We're going to ask that you not submit multiple applications. And then we're lastly going to ask you not to wait to the last minute. So it's Murphy's Law that if something can go wrong, it will go wrong. So take these next 2 weeks before the application opens, get all your things ready so that when it does open, you can thoughtfully and thoroughly prepare your application and submit it. All right, let's get to the application questions. You've probably been waiting for this part for a little bit. So the application questions have 3 parts. So let's look at this first one. Tell us about a time during your clinical rotation when you've experienced a caring moment for a patient. How did this moment affect the patient outcome, and how has it changed your clinical practice? So in this application question, you can see there are 3 parts to this. The first part is you're going to describe the situation. Tell us about the moment. What happened? And I want to highlight that we're asking for this moment to be part of one of your clinical rotations. We recognize that some of you are working in roles such as nursing assistants or techs or completely unrelated roles right now, but you are applying for a job in a clinical nurse. So that is the light we want to see you in. So think about your clinicals and a caring moment that you experienced and share with us what happened and what you did. And then share the result. What changed in your clinical practice? This is the part that we're really going to focus on. And this is the part that we score. So let's give a simple scenario of an example. So maybe you sat with a concerned family member, or the family member felt relieved and then calm. And then what did you learn from the interaction? And what do you do differently now? Maybe you wash and style the patient's hair in anticipation of their family visiting. The patient verbalized feeling refreshed and beautiful and was smiling at when their family was visiting. So what did this moment teach you about the human-to-human connection? So what we want to say here is don't leave a response open to interpretation. We want you to be very concise, and we want you to share with us exactly everything that you learned, and then how your practice has changed as a result of these experiences. So another example, a time in my clinical rotation, I had a caring moment was when a patient I made them laugh during a stressful time. This moment affected the patient's outcome when they said they haven't laughed that hard in a long time, and it felt so good. This changed my clinical practice because I am now more aware of the human to human connection and how I can change how a person feels. So all the components of that question were answered. They were actually very easily answered with simple one-liners. But what makes you successful or what you had the most impact on your application will be how you answered again that third component about how it changed your clinical practice. So there's a difference between acknowledging that it's important versus being consistent and committed to specific caring practices. So take your time to answer these. It could be the difference between an average answer and an excellent answer. So let's look at these a little more closely on the next slide. So these are the 4 questions. So again, no mystery here. These are the questions that are on the application. So I want to read through them with you really quickly. We talked about the first one already. So the second question is, tell us about a time when you had an error in judgment. This can be a personal, professional, or academic error. We are all humans. It happens. So this is your opportunity to be vulnerable. Share what happened. What did you learn from this experience? And how has this experience shaped you into the nursing professional that you are today? The third question is, tell us about a time when you provided service to a community. What type of service did you provide? So maybe you assisted a neighbor, maybe you volunteered at a homeless shelter, or maybe you coached for a youth soccer league. How has serving a community prepared you for a profession that is committed to compassionate service? And then the last question is, successful completion of a nursing program requires hard work, persistence, dedication, and resilience. Share with us what initially motivated you to pursue a career in nursing. What goals did you set for yourself? What obstacles did you overcome to achieve those goals? So again, those are the questions on the application. So I mentioned in the previous slide that how you answer the third component or the bolded areas in the questions can make a difference between an average answer and an excellent answer. So when preparing your application, refer to these questions and think of some experiences and scenarios that you could use. Brainstorm a little and write these down. When you're looking at that component, ask yourself, what makes this experience memorable? How did you go above and beyond? How much reflection and learning occurred as a result of this experience? What were your lessons in action? Did you share and emphasize how you used this experience beyond nursing? How has your journey to this point shaped the way you think, act, or perform? And then do you demonstrate a growth mindset? Is it evident in your response? And so a growth mindset is really referring to people that even when they struggle with certain things, that they know that those skills can be developed. It's that time and hard work where there's a lot of learning, not only about a particular skill, but about themselves and what they're capable of. So if we look at question 2, okay, and we read that, okay, an example could be, a time I made an error in judgment was with my daughter's dance class. I inappropriately judged a parent for being late, only looking at how it inconvenienced myself and other parents when we were waiting with their child until they arrived. Although they were always apologetic, I would unknowingly ask myself why they couldn't get there. That is until I was going through a stressful time and I was late. When I arrived, I found the other parent was there waiting with my child. I apologized and they shared with me that they understood and then shared some of their own struggles, that they were caring for a parent at home, that they were juggling 2 jobs. I was embarrassed and humbled, and I learned to lead with grace for myself and others. And remember, I will never know what people are going through. At this point in this question, this is where you demonstrate how you lead with that grace and what you do to remember that everyone has their own story and how has this shaped your practice and what you now do differently as a result of it. In the question number 4, you share what motivates you in terms of your nursing and why you chose to pursue it. what your goals were, what your obstacles were. Within each of those questions, share what that hard work was, the persistence, the dedication, and the resilience, and what those were for you. Were you able to adapt and change and grow as a result of your experiences? Talk to us about the commitment you made to yourself or to your family to pursue that goal. We want to read about your determination. We want to understand your story. So tell us about it and be specific and be detailed. It's okay to be vulnerable here if you feel safe to do so. So you might have some additional questions. And so I want to be able to give you the opportunity to look for some additional resources. This is our careers page. I have a QR at the top. Leticia or Carrie, if you guys wouldn't mind putting the careers site link in the chat below so that we can go ahead and provide them with these resources. If you go to this page and scroll down to the bottom, you will see a section that says frequently asked questions. If you click on that Learn More button, it'll give you an opportunity to see some additional questions related to cover letters, resumes, and the applications itself. And so if we did not address something here, perhaps this will address your question. I also want to share now some information that you could possibly be interested in related to salary and relocation. So the base rate for our starting clinical nurses is $85.77 per hour. And then in addition to that, there are shift differentials. So if you were to be working an evening shift, a night shift, or a weekend shift, you can see the differentials that you would receive on top of your base rate. We also offer relocation assistance up to $5,000 for those that are out of the area. And then we have some housing programs as well that we can provide you should you need that. You will start accruing PTO, paid time off, on the date of hire. And then lastly, we have a comprehensive medical, dental, and vision plan. You have a total of 3 different plans that you can choose from. And then tuition reimbursement is $1,800 per year. That can be towards, again, education that you want to in your professional development, or it can be used to pay back student loans. So a couple of important reminders before we get to our Q&A session. So application checklist. You will want in just one PDF document, your transcripts, official or unofficial, your cover letter, and your resume. Ensure that the topics listed are the topics that you are including, and then you will include or complete rather the electronic application. So you do not need to submit your BLS or ACLS. You do not need to submit any additional certifications. In fact, we ask that you do not, so that that doesn't get confusing or complicated for you. You do not need to submit letters of recommendation. I want to take this opportunity to remind you that our California RN license is required by February the 14th of 2025. We only want you to apply one time. And if you are concerned about your application and it's been 24 hours and you've created that account and you're still not seeing it or not seeing your documents, you may email those documents to New Grad RN. Again, that's by 11/6 at 5 p.m. Eastern Standard Time. We want you to be very mindful of the application window and not to wait to the last minute. We often see that applicants will wait until that weekend before it closes. And should you have any issues at all, that will make it near impossible to resolve. We will not accept a late application. So we also ask that you use one identifier that remains consistent on all your documentation. So for example, if your name is Daniel on your transcripts, but in your resume and application, you're writing Dan, our preference would be that you are writing Daniel on all of those. That way we can ensure that that there was no miscommunication or that there was some other glitch, and we're not talking about 2 different people here. Applications that do not have all the required documents will not be considered, and the application will not be processed. And so last but not least, make sure you are answering all 4 application questions. Do not leave anything blank. Okay? So with that, we're going to transition to the Q&A portion of our webinar. I'm going to ask our residents in just a moment to introduce themselves and then share what made them successful in the application process. I'm going to stop sharing my screen now. All right. Hello, everybody. Okay, so I'm going to go ahead and have our residents introduce themselves. You will have an opportunity to ask them questions related to their process and what made them successful. If you have questions outside of that, I will ask you to put those in the chat. I will also ask you to be mindful of the chat, and if someone is already asking that question, not to re-ask it. So please be mindful of that piece so we don't overwhelm Carrie and Leticia. So Daniel, if you wouldn't mind coming off mute and sharing with us, just introducing yourself, where you are working, what school you went to, and then maybe what made you successful in the application process.
Yes, of course. How's it going, everybody? So my name's Daniel Carr. I work on F3, which is a medical oncology unit at Stanford, of course. I went to Cal State East Bay for my BSN out of Hayward. And I think what made me successful in the application process was my intentionality. I took it very serious and I used a lot of the resources that Christy and Carrie and Letty have provide. And if you really just kind of focus in on those and are friends, I think that really helps your chances.
Thanks, Daniel. Gabby, same question.
Hi, everyone. My name is Gabby. I'm on M6, which is a advanced lung disease unit. It's mostly like lung transplant, cystic fibrosis kind of thing. I went to USF. And what made me successful, I would say, was kind of similar to Daniel, where I was super detail oriented. Like I went through these webinars and I paid attention to every single detail that they were saying. And I was also like really authentic to who I am, what my values are. And I tried to portray that as much as possible through my application.
Thanks, Gabby. Riley?
My name's Riley. I work in the emergency department. I went to school out of state in Utah. And I would say what made me successful in the application, similar to what Gabby and Daniel have said, just being really authentic and intentional in all of your writing and stuff like that, but also doing quite a bit of research into Stanford. And I really wanted to know, the hospital that I was signing up to work for. And found out, things that were important to them and how that aligned with what was important to me, and highlighted that in my essays and my cover letter. So just made myself like a good match for the hospital.
Thanks, Riley. Okay, now that our residents have introduced themselves, I would like to open it up to questions. What I will ask is that you put your virtual hand up, and then I will call on people one at a time so that we can not jump on top of each other. So I'll give you guys a minute. I'm sure you've been thinking about STEM stuff. All right, Jose, I see your hand up. Go ahead and come off mute.
Hi, thank you for having us all. I wanted to know, I know you said that you can only apply once, but I'm also interested in applying for the Lucille Packard's nurse residency program. Is that considered a second application, or would that be okay?
I'll take this one, residents. So that is that's second. They're actually not affiliated with our nurse residency program. So the Lucille Packard is the Children's Hospital. We are family, but we are not within the same program. So that is a separate application. They have separate requirements.
Thank you.
Chand, I see your hand is up.
Good morning. I just wanted to ask, when it comes to the cover letter and the resume specifically, is there a page/word limit for those two things?
No, there is not.
Okay, thank you. Appreciate it.
Michelle?
Hello, thank you for taking my question. I am clearly in understanding of the requirements for references. I was curious if, in addition to clinical faculty, may we include individuals who precepted us at Stanford in addition?
So for the two references that we're looking for is strictly related to your clinical instructors. So as long as you have those two, if you're choosing to add more, that is fine, but we're strictly looking at that.
Okay, great. Thank you.
Mhm. Jeremy?
Hi, is my mic working?
Yes.
Hi, my senior practicum has been in addictive health, and I've also worked over the summer at an addictive health medicine. I wanted to ask if any of the inpatient psychiatric placements for this upcoming cohort would follow that patient population.
They might follow those populations. They certainly deal with those issues, but I couldn't say specifically related to what you were doing specifically in your clinicals, though.
Thank you.
So for the panelists here, if there are questions related to specifically what made you successful or how to be successful, I would say those are the questions that we want to work with right now with our panelists. If you have questions specifically related to the resume process or cover letters, very specific questions like that, I'm going to ask that you go ahead and keep those in the chat and that Carrie and Leticia can address those. So if you have a question for our panelists, I'm going to ask that those virtual hands go up. Hillary, I see your hand up. Do you have a question for our panelists?
Yes, I do.
Great.
Awesome. Well, thank you, panelists, for sharing a little bit about yourself. And I was just curious, in terms of your experience, both volunteer and work experience, what do you think was something that kind of made you stand apart from other applicants?
Thank you, Hillary. Daniel, do you want to take this first question?
Yeah, sure. Thank you so much for the question. I think it's really important to remember that it's not necessarily the type of experience, it's more the quality. And what I mean by that is you can do, just about anything if it's in terms of volunteering or in terms of previous work experience. I think what really makes the difference is what you gain and what you learn from the process. So I could tell you what I did, but I don't know if that would necessarily be beneficial for everybody. I think what's more important is to kind of really dive in. So if it's a volunteering opportunity or experience, just make sure that you're really engaged. You're there. You're asking yourself those questions. If it's a certain population that you're working with, and it can be anything. It can be anything that's important to you. It's more so just about sort of self-growth and development. And I think that's what's going to make you stand apart more than the specific experience itself.
Thank you so much for sharing.
Thanks, Daniel. Alvaro?
Hello. So I have a question for the panelists. So my question, I come from I am in Bakersfield, California. It's a very small town, 2 hours before getting to LA. Our medicine here and our nursing care and some procedures that we do here are like 10 years behind LA, San Francisco, Bay Area. So as a new grad, if I were to get accepted into a position for Stanford, my question for the resident is, how successful are your mentors and your preceptors setting you up for success with new medicine coming in, change of nursing practice, because it's constantly changing. And for me, it would be something a whole lot different, just because I already know that we're 10 years behind here where I live. And then my next question is, how does Stanford involve culture? Because they're serving so many different cultures. So how does that reflect on the staff?
Thank you. Gabby, do you want to address this question?
Yeah, I would love to. I think it's a great question. So I think working at Stanford, one of the best parts is that we are implementing all of this new stuff. Like, it's super exciting. And my preceptors and honestly everyone on my unit is like so willing in it and excited to help me learn and incorporate these new things into my practice. So it's incredible. I kind of felt like I was like talking to my other cohort mates about this, and I kind of felt like when I was in my preceptorship, it was like I was and had training wheels on my like tricycle. And I was like biking away on my tricycle. And then when I got off of my orientation, it was like I'm biking on my own now. So yeah, it's like there's just so much support. And they'll help guide you through all of that new stuff. And in terms of the cultural aspect, this is something that I'm super passionate about, like cultural competency and diversity and equity and inclusion. And that's something I talked about a lot in my application and in my interviews. So that's something I would encourage you, if you're passionate about that, to talk about that. Because I think it is something that Stanford values and wants to shine a light on, I would say, which is what drew me to Stanford in the first place. So yeah, I hope that answers your question.
Thank you.
Thank you. Alicia, do you have a question?
I do. I know one of the panelists came from out of state to Stanford, so I would just love to hear the experience of transitioning to California, and if there's anything that specifically stands out that's helpful in that moving process.
Okay, well then you know who you are.
Yeah, so I was actually living here for like 9 months before I started the program. So as far as like the relocation assistance program that they have, it didn't really apply to me, but I did look for a place to live from out of state. And that was kind of difficult. I know that I know that there's like a Facebook group for new grads, or yeah, just for new grads. And I know that there's also one like kind of for Stanford employees, and they help facilitate getting you an apartment, or kind of finding other people who are moving into the area who are looking for roommates who are also Stanford nurses. So if housing is one of your concerns, I would encourage you to look on platforms like that to find people who have recently moved out here, or who are just in the same situation as you and looking for a place to live, so that you can go in on stuff together. Yeah, I hope that helps.
So thank you.
Mhm.
Thanks, Riley. Michelle, did you have a question?
I did have a question. You know, my personality tends to be a bit more formal. I was curious of an example of showing your personality in a cover letter.
Okay. Daniel, Gabby, Riley, anybody have an example?
Yeah, sure. I can. That's a fantastic question, by the way. Thank you. And it can be challenging, right? Because I myself also like to be in person. I think most of us probably would. I think it's easier to sort of express your emotion in person. But obviously, in this scenario, you have to find ways to express that through pen or typing. Um, I think the best way is to really kind of go back to how like the experience has developed you, and really sort of because again, your cover letter is going to be extremely unique to you and sort of how you've grown, and again, why nursing. So if you just use more examples to like sort of it's hard, but okay, so like for me, for example, maybe this will clear it up. I took my preceptorship, which was at Stanford, and again, it doesn't have to be at Stanford, but for me, I took how that patient population, like what impression was left on me after finishing my preceptorship, and it was oncology, and how powerful it was to work with those patients and their families too. And so I really explained thoroughly like how profound it was to me, and I think that sort of helped to sort of express my personality in some regard.
Great, that's an awesome answer. I appreciate it.
Thanks, Daniel. Vishaka, did you have a question?
This is kind of more in terms of like for the panelists, your experience with nursing. I know this like job app season, transitioning from student to new grad nurse or like occupation can be really intimidating for a lot of us. What are some things that you guys did to maybe deal with like the imposter syndrome or like that transition for when you had that time?
Thank you. Gabby, do you want to talk about that?
Sure. Yeah. I think the transition was difficult. I did experience imposter syndrome, but it's possible to get through that. I really, no one else is going to be your best hype man other than yourself. Like, you got to hype yourself up and be like, I deserve to be here. I've worked hard. I earned this. I'm worthy of being here, and really believing that. And it can be hard at first, but I think, like, especially when you're in this like application phase, I feel like I was getting input from so many different people, like, you should do this, you should do this. I guess, yeah. I would say just try to stay as true to who you are as possible. That's what really helped get me through this, is like being really solidified with what my values are, with what my self-perception was, with my own self-worth. I think I learned a lot about that through this whole process. But yeah, once you're like, I don't know, I'm like 7 months in and I'm like, okay, I got this. Like, I feel like I'm part of the team and like I'm doing it on my own. So the imposter syndrome does fade away. Yeah.
Thanks, Gabby. Hey, Riley, what about you? You're a little younger in the process?
Yeah, I have only been at Stanford for like a month and a half. And I feel like imposter syndrome is one of the biggest things that I struggle with. In the emergency department, everyone is very, very, very smart. They've been doing this for a really, really long time. And so it's tough to come in and be brand new and just have like a fraction of the knowledge that everyone around you has. And so I struggled with that a little bit in the beginning, and I'm still struggling with it. But I feel like Stanford does a really great job at creating a culture of understanding. He's not even a preceptor. I feel like he just kind of treats me like he's one of my preceptors. He's just, people are so willing to teach. And he was like, you're in this lucky spot where you can ask whatever question you want because no one expects you to know anything. And I thought that was really great. And so I feel overwhelmed by the knowledge that the people around me have, but really grateful to be in an organization that's a teaching hospital, and doctors, residents, other nurses, respiratory therapists, pharmacists are also willing to stop what they're doing and explain why they're doing it. And that just builds your confidence as you continue to learn. So I think that in order to kind of overcome the imposter syndrome, you have to, one, recognize that you deserve to be where you are, and that you earned it. And then also to never stop learning. Like, just because you get an interview, just because maybe you get the job, doesn't mean that you know everything. Obviously, you just have to work really, really hard to build your knowledge and be at a similar level as these other people. And that just takes time and kind of giving yourself the grace to take the time, because you have to recognize where you are and where they are and what's happened to them to help them get to where they are, and just work on that step by step. So just giving yourself lots and lots of grace.
Thanks, Riley. Dara, did you have a question for our panelists?
Yes, ma'am. Thank you. Are you able to hear me? Okay.
I'm having trouble hearing you, Dara.
Are you able to hear me okay?
Yes, that's better.
Okay. I had a question for Riley specifically. I am in Texas and I graduate in December, and I'll be transitioning to California. And just wanted to know about the overall process of, I know how to do the endorsement for licensure, but with the specific date for this cohort, does the endorsement need to be completed prior to the 14th, or can it be still in process up until the date of the start of the residency, if that makes sense?
Christy can correct me, but I'm pretty sure it all needs to be done by the 14th. Like, you need to have a license in hand, a California license in hand by the 14th.
Okay, thank you so much.
So have you already taken the test in Texas?
No, okay. I have not. Yeah. I think the soonest I can take it is like towards the end of December.
Yeah, I did my application, my license by application. So I didn't do the endorsement process. I just tested and got my first license through California. And that process was, my personal experience was, it was a lot quicker than what I understood the endorsement process is. I would encourage you to go on Breeze, I think is what it's called. And they can kind of, they tell you like which applications they're working on right now. And when I was looking at it, the endorsement ones were a lot further behind than the application ones.
Thank you. That's helpful. I appreciate your input.
Thanks, Riley. Karina, did you have a question?
Hi, yes, I did. I have two questions actually. The first one is, as far as the units, I just wanted to understand really the terminology of it. Is the surgical medical AAU equal to what would be like a progressive care unit or a PCU, or is this a mixture of both a PCU and med surg within the hospital?
I would say it's like a mixture. Karina, I think we lost you for a second. All right, Karina, when you get back, I'm not sure if you can hear me, then you can, I'll come back to you, okay? Naomi, did you have a question?
Yeah, I just wanted to thank the panelists real quick. And my question is, what was the mistake you did during the interview process and what would you have done differently? And if you're comfortable with sharing, like, what were common mistakes that you saw others doing, like during the group panel, and what would you recommend?
Daniel, do you want to start with that one?
Yeah, sure. So I think a mistake, I think honestly, just being nervous, which I know sounds kind of silly because it's like everybody's nervous and it's normal to be nervous, and it is normal to be nervous. But I think I realized that, you know, they're just trying to get to know you. They're trying to get to know you as a person, and they just want to learn more about you. And I think being nervous on the panelist interview, it makes it a little bit harder for yourself to be seen. So I think if you take some deep breaths, you just try to, you know, be patient with yourself and just kind of let it flow, be natural, and just remember that we're all human. We all make mistakes. We don't always have perfect answers. So yeah, but I will say on that same token, I did take it very seriously, and I did kind of like study for my interview. And so, you know, I was prepared, but you can't always be 100% prepared. Yeah. And then you had another part to your question. Sorry, what was that again?
No, I think you answered it really well. Just
Okay.
because like, yeah, and I totally understand.
Yeah. Okay.
Thanks, Daniel. Elise, did you have a question?
Hello. I was wondering if any of you have like other career goals, possibly transferring to another unit. I'm thinking about Stanford flight as my eventual final goal. How do you feel if Stanford is maybe like, do you feel kind of stuck in one unit, or do you feel comfortable switching and progressing?
Gabby, do you want to answer?
Sure. Well, I would say that Stanford is an incredible place to grow and accomplish your goals. Kind of like how Christy was saying in the presentation, there are lots of different programs within Stanford that can help you achieve your goals. And I would say it's a great thing to talk about what your ultimate goal is, like in your cover letter and in your interviews. There's a critical care training program in Stanford that you could go to, and then after a couple of years in critical care, you could do life flight, which is such a cool career, by the way. But in terms of myself, I know that I would like to go back to school one day, and I talked about that in my interview, and my management is aware of that I'd like to, I don't know, like develop professionally. And that's something that Stanford is like really encouraging of, and they actually like will help you pay to go back to school. And so yeah, I think Stanford's a great place if you want to pursue that.
Thank you.
Thanks, Gabby. Monica, did you have a question for our panelists? Oh, I think we lost you, Monica. Okay. Josie, did you have a question?
I think she might.
Oh, sorry. Well, I think
Oh,
my
are
mic
you
was
there?
off.
Oh, there you are. You
Yeah.
moved. Sorry, you jumped
Yeah.
one spot to another. So sorry.
I think it might hand. Sorry, it might be a long-winded question, but how is it like balancing learning how to transition into clinical practice, doing all like the EBP projects and other mentorship activities? Is it overwhelming? Do you have to take time outside of work hours to do the project? And are you able to find like a good work-life balance?
Okay, good question. Riley, I'm going to skip you on this one because you haven't started the EBP work yet. So Daniel or Gabby, do either one of you want to speak to this?
Sure. So yeah, it's really, I don't want to say easy, but I think they factor in the fact that our job is very stressful and time demanding. So all of the EBP practice project stuff we do in our seminars. So there's not really like outside work that you have to do. I mean, you could think about it if you want to, but it's not like you're not obligated to. So yeah, I would say it's a good balance. It's not too overwhelming. Sometimes the shifts themselves can be overwhelming, but I would say like it's not too difficult to manage. Yeah.
Thanks, Gabby. Daniel, any other comment?
I think she explained it quite well. I mean, just for reference, I mean, I'm in Chicago right now. I'm actually at a Society for Neuroscience scientific conference, and we presented this past Saturday. So you can have activities outside of it. I don't feel like I'm super overwhelmed. I feel like the NRP is very supportive and my unit's very supportive, and they really do try to work with you. So it is very doable. Yes.
Thank you. Josie, question for the panel?
Hi, yes. I was just wondering what the interview process was like for you guys and what types of questions you guys were asked.
Riley, do you want to answer that question?
Yeah, so there's like the two interviews, if you go through both of them. The first one is just like with the NRP team. And the second one is with the actual unit that you would be interviewing for. They were, both of mine were online. Sometimes the second one is in person, I heard. The first one was, I want to say like 4 behavioral questions. And it is alongside like 4 other people who are also interviewing for the position, which can be a little nerve-wracking. But I didn't mind it as much as I thought I would. I think knowing that going in, it wasn't too daunting. They ask a question, you each get a chance to answer a question first of the 4, and then they just cycle through all of you. And then I don't know what the difference was. The second interview where it's just with your department, that one, they asked me 4 behavioral questions and 4 clinical questions. And that was like the mistake that I made, was not preparing for clinical questions. I was very much preparing and practicing for behavioral style only questions and considering situations that I had been in and things like that, and how to kind of spin any question that they asked me into my 4 or 5 experiences that I had prepared. And I didn't spend a lot of time reviewing clinical things. So I would just keep an eye out for that in the interview process.
Okay, thank you.
Mm-hmm. Thanks, Riley. Cassidy, did you have a question for the panelists?
Hi, yeah, thank you. I know a lot of the nurse residency programs, especially in the Bay Area, like to have their new grads start on a med surg or a tele floor. So kind of a question for all the panelists. Did it feel intimidating at all, or how did it feel generally being able to start in the specialty that, you know, some of these other nurse residency programs are saying, okay, you can apply after 6 months or a year of starting in med surg tele? What was the process like? Did you feel supported by Stanford during that process? Just all of that. How did you feel?
Daniel, do you want to answer that question?
Yeah, sure. Thank you for the question, Cassidy. You know, sort of a short answer is yes, I felt extremely supported. I think it's a little bit intimidating. I went straight on to a very oncology heavy unit where they do a lot of chemotherapy, they do a lot of blood transfusions, they do a lot of things that were way over my head. But your preceptors know that. They know that you're starting out. And it's a stepwise process. You go through the TSAM, kind of like Christy had mentioned earlier, where you start sort of at just the basics. So you're just taking vitals, you're just doing head to toe assessment. They're not going to just throw you in and say, here, do this blood transfusion and do it right the first time. And no, so that they'll definitely kind of guide you through. And I'm still fully in the learning process. We're 7 months in, and I just started the oncology transition to practice program, because that starts after 6 months. And so there's a whole world of the oncology patients that I've been working with that I still don't know. But I always have my charge or my floats or just other experienced nurses. And even though we're on the floor by ourselves now and nobody's precepting us, I'm still constantly asking them, hey, can I just double check? Can we, we can run this blood at 240 mLs an hour, or let's check the policy. So there's a lot of resources, and you're never alone.
Thanks, Daniel. Rupali, did I say that correctly?
It's Rupali.
Rupali, okay. So sorry. Did you have a question for the panelists?
Yeah, I did. So I am from Fresno, and we kind of have like a little bit of a smaller hospital compared to Stanford. A lot of the nurses that I work with explain that magnet hospitals have a lot more resources than like a smaller hospital that I'm from. I just wanted to ask what is considered as your guys' resources specific to each one of your guys' specialties? And then the second question was, what differences have you guys noticed being in a teaching hospital rather than just a hospital?
Okay. Riley, do you want to take that question since you're in the emergency department and out of state?
Yeah. So as far as specific resources, we have, staffing is a huge thing. We've got a lot of like extra helpful staff. There's an extra nurse assigned to every pod in the emergency department, just as a float nurse. And he or she also makes sure that everyone gets to go on all their breaks. So you never really feel overwhelmed in that sense. Like there's always a qualified nurse right next to you who can help you if you feel overwhelmed with anything. Respiratory therapy is super, super helpful. They're super easy to get a hold of. The pharmacy is always nearby. I have lots of questions for pharmacy, and I can just walk by their office and pop in and ask a question or message them, or they're often bedside. I know that the floor also has something I think called like lift tech or something like that, which I learned about right at the beginning, and I've never seen them in the emergency department, but I think we have like different beds than they do up there. But it's people you can call if you have a heavy patient and you need help moving them. So I think that's great for saving our bodies as we're working with patients that can sometimes be difficult to move. Policy tech is huge. That's where like every policy that Stanford has is, and it's just on the computer, and it's super easy to reference it and look up, okay, I forgot how to do a blood transfusion. This will walk me through it step by step. The other night we had a PCA, and we don't get a lot of those in the emergency department. And so there was one nurse who had worked inpatient, and she was able to walk essentially the whole pod through it because all of us had no idea what we were doing. But we could also reference the policy tech policy. So just a lot of good resources. Your techs are super helpful with doing tasks that you just can't get to and things like that. As far as being a teaching hospital, this is one of my favorite things about Stanford. And one of those things that I would say, like in your application, if this is something that interests you, like research what it means to be a teaching hospital and include that in your application, in your cover letter, if this is something that means a lot to you. You're working alongside residents who I had never worked alongside before, and attendings. And so you get to kind of understand, it's a very fun culture for everyone to be learning right next to each other. And the residents are super approachable, and I haven't always felt that way in other hospitals. I think everyone is approachable at Stanford, and that's likely because it's a teaching hospital, because everyone's willing to stop and teach.
Thanks, Riley. Mm-hmm. Jose, did you have another question?
Yes, thank you. My second question is, what is like a major difference between going from being a student in your full-time preceptorship to then transitioning to a new grad program? Because I still feel like I'm definitely a student. I have all this homework. I understand that there's no outside work when you're part of this new grad, but in terms of the work that you're actually doing at the hospital, what are those differences like from being a student in preceptorship and to being in the new grad program?
Thank you. Gabby, do you want to take that question?
Sure. Yeah. So it's definitely a transition. I would say the main thing is just like responsibility and accountability over your patient. Like it's your license, you're taking care of this patient, you're responsible for this patient. It's just a little bit more pressure, I guess, at first. You kind of get used to it, but and you're still learning. Like people know that you're new and they want to help you learn, but also like the providers and stuff won't talk to you like you're a student. They'll talk to you like you're a nurse taking care of this patient. So so yeah, the communication's a little bit different. I would say like the energy that you feel when you walk into a room is a bit different. It's like, okay, like I'm the nurse now, like I'm not a student, I'm in charge of this patient. So it's just kind of a bit of a mental shift. Yeah.
Thanks, Gabby.
Thank you.
Chris, did you have a question?
Yeah. For those of you that did a specialty for your preceptorship, like peri-op or OR, how was the transition into general practice? Did you feel like it hindered you in any way? Maybe you should have done a med-surg specialty for your preceptorship?
So did anyone have an OR experience? Could speak to that? Some other type of specialty?
Yeah, or something else.
I was for my preceptorship, I was in the neuro ICU, which is kind of a bit specialized, like for neuro stuff. But I would say whatever specialty you do for your preceptorship, it's all gonna apply. Like it's all gonna apply. It's just gonna help you. In like if you go into a medical or surgical floor. Like I know that my background in neuro and even critical care like helps me with my critical decision making on a lung transplant unit. They're all interconnected. Like we tend to like separate all these body systems into like different things, but they're all like woven together into the human body, So I would say don't worry too much about the specialization.
Thank you.
Thanks, Gabby. Benjamin, did you have a question?
Hello, thank you for taking my question. I have a question for the panelists. I was wondering if any of you have any previous medical history prior to going to nursing school?
Let's see. Anybody work in the medical field before, like as a tech or a nursing assistant or anything like that?
Yes, I did. Thanks for the question, Benjamin. I worked as an LVN for about 4 years before, well, before I got my RN license. At that point, it had been about 4 years. And then I was a CNA for a short time before that. I had gone through an EMT program before that. And, even though I had all of those experiences, like you would think that, I would be able to just jump straight into being an RN in acute care hospital, but it wasn't that way. It was still, a big transition for me. You're taking care of a lot sicker patients, especially at Stanford with the AAU design. So you can take care of patients that are pretty sick. But I've seen people who, had no sort of healthcare experience prior to getting to Stanford's new grad program, and then people like me with, several years plus. But we all learned at the same pace, and I feel like we all get the foundation of nursing through Stanford's new grad program that we need to be successful.
Awesome. Thank you, Daniel.
Thank you. Marvin, did you have a question?
Yes. Hi. Thank you for the panelists too. I have a question for Daniel. Daniel, I heard that you are in the oncology department, so I was wondering when you applied, did you specify a specific subunit on the oncology department, or you just selected oncology for your desired unit?
Thanks for the question, Marvin. No, so when I applied, I just chose oncology, and then sort of based off of Stanford's needs at the time is kind of what units will be available to accept you. I think at the time there was, I know my unit F3, and then I think there was C2 or C3. There was another medical oncology unit. And so it really depends. Sometimes they have bone marrow transplant available. Sometimes they have hem-onc, med-onc, just sort of depends.
Okay, so pretty much just the oncology department for the application, right? And then it'll be based on the need of the department where they're gonna place you. Okay,
Yeah.
thank you.
Yes. Yeah. And just one thing to note too, during the panel interview, you'll have managers from the oncology division like a general, and then they'll sort of decide which panelists that they're going to send interviews for their specific unit. So you'll kind of meet them in that first interview, and then the second one is when you'll figure out if you're going to go to that unit specifically or not.
Right. I have another question. Sorry, this is for you. I'm also in LVN. I've been in LVN for like 4 years, and I'm really interested into getting into the oncology. So I've done a lot of like what is it called? Case management for hospice on cancer patients. Will that help on the interview, or it will be like a red flag? Or what was your experience like being in LVN transitioning to this specialty in specific?
No, I think that will be amazing. I think that will help you a lot. You know, whether it's bedside care, whether it's case management, at the end of the day, you're still facilitating care for patients. And so you have a deeper understanding of things that are going to happen outside of the hospital, which arguably is, well, I mean, it's just all of it's important. But no, I think being an LVN helps. I mean, you've had FaceTime with patients. Have you had bedside care with them as
Yes.
well? Yeah, so all of that's going to be great. But again, you really have to draw on those experiences and find ways to really reflect and think back and remember that patient that you took care of, and how that impacted you and why was it important. Because you don't have to be an LVN, but I think it can help. But again, just really draw on those experiences and reflect. And I think that'll help the most.
Thank you.
Thank you. Sarah, did you have a question?
Yes, I had a question. First of all, I wanted to say thank you for your time. And then my question is, what do you know now that you're in the residency program, that you wish that you knew at the beginning of the process?
Good question. Any thoughts, any of you? Looks like that one's a stumper.
I think just for me, it does stump me a little bit because I feel like I'm still right in the heat of the moment. Like I'm just past halfway of the new grad program, just starting the oncology, portion, and I still don't know a ton of stuff. So I think one thing would tell myself, maybe this can help sort of answer the question, is just to trust the process. Just keep your mind open. Just understand that people are there to help you, and people are there to sort of teach you to become a good, solid found nurse. And just enjoy the process. I think I was nervous about a lot of things, but then I realized like the patient is the center of everything that we do. So just enjoy it, help them. That's what you're there for. Yeah, I hope that answers a little bit.
Thanks,
Yeah, I'm
Daniel.
sorry for stopping y'all. Thank you.
They don't know what they don't know yet. Andrea, did you have a question?
Hi, yes, I did. Thank you guys so much for your time. I was actually just wondering if you wouldn't mind expanding more on what a typical week looks like for you in terms of actually having time on the unit versus actually meeting as a group with the program.
Sure. Gabby, do you want to take that one?
Sure. Yeah, so on the unit, let's see, I'm trying to think back to when I first started. So the seminars are 1 to 2 times a month, depending on like where you are in the program. Right now, for me, I'm just going in once a month for 8 hours, for like the group cohort seminars. And then otherwise I'm working three 12-hour shifts in the unit. Yeah, so I think it's a pretty good balance. It's not too demanding. And on those weeks where I do have my seminar, I work 2 12-hour shifts, and my unit prefers that I work an 8-hour shift as well. So yeah, I hope that answers your question.
It does. Thank you so much.
Hi, Nancy. Did you have a question for the panelists?
Hi, yes, mine is similar to the question Andrea just asked, and it was regarding the schedule. What is the expectation once you're in the residency program? What does your week look like, and then moving forward after beyond that?
Riley, do you want to talk about your schedule a little bit?
Yeah, mine's pretty similar to Gabby's. I have the emergency department has like a class that we do every week together as well. So I have 4 hours of that class every week. And then I'm currently working 40 hours a week with the understanding that it drops back to 36 hours once my preceptorship is done. I spend anywhere from, I spend like probably the equivalent of 3 12s on the floor every week with my preceptor, unless I have the NRP program, then one of those shifts gets cut back to 8. And then I do my ED class on top of that. And then once my preceptorship is done, the ED class is done. So it's the expectation is full-time. You're applying for a full-time position.
Thanks, Gabby. Alicia, did you have a question?
Hi, thank you for taking all of our questions. I actually have 2 questions here. My first question was, in your experience, is Stanford's model of teaching or providing healthcare more teams-based, or has it allowed for you to learn and practice a variety of nursing skills within the scope and to see a lot of things? And when I say teams-based, I mean, I've heard of some hospitals where they have an IV team, and so their regular staff nurses don't even really get to perform IVs because they have a whole team just for that. So I was wondering about that.
Daniel, do you want to comment on that?
Yeah, I think it's sort of a mix. We do have, Stanford is very specialized, of course, so and it's a very large academic center, so you're going to have a lot of people that can help. I do see, because okay, for like IVs, for example, on my unit, we put in IVs all the time. We access ports all the time. We still do a lot of skills ourselves, but we do have like a PICC line nurse that can come and put in a PICC line. And we also do have like an ultrasound guided IV nurse who can come and put in an IV if you have a difficult access patient. We still get to do a lot of interventions ourselves, but we always have support and help for people who are more experienced. We have acute care nurses who can come by and also put in IVs. They can do chemotherapy for you, but we can also do those on the floor ourselves if you're certified for that stuff. So I think it really just kind of depends on the scenario, but I feel, at least so far to this point, I've been able to do a ton of things sort of independently, as long as I feel comfortable doing them. But I always have help if I need it.
Okay. And then my second question is, I guess what in your experience has been the patient population, like, maybe demographics or the social determinants of health, like what has been the patient population that Stanford sees? I used to work in the East Bay, and a lot of those patients were like self-pay, I'm paying for my care, so give me better care. And then I also worked in San Francisco, and that was the, majority of them were 70 and up, Medicare, Medicaid. And so I've seen a variety. So I was wondering what the patient population demographic is like at Stanford.
Gabby, do you want to take that question?
Sure, yeah. It's a wide range, like it's really wide range, and it varies from unit to unit too. So on my unit, on lung transplant unit, we do have a lot of geriatric patients, I would say, but in terms of like insurance and the social determinants of health, it's a very wide range, and something that I'm passionate about is caring for people from all sorts of different populations. And I do feel fulfilled in that sense, where I feel like I get to care for people from different classes and different races and just like all sorts of different populations. And so, yeah, I feel like Stanford has a wide variety of people that we serve.
Thank you.
Thanks, Gabby. So due to time, we're going to go ahead and take just one last question right now. We appreciate everyone being so patient. Leticia, if you don't mind, we have a survey, everyone. If you wouldn't mind, Leticia is going to put the link in the chat. We just want to understand how helpful today's webinar was, and if there's any other information that would be helpful to share. Angelica, I'll give you the last question of the day.
Thank you. So I'm not sure if it's already been asked or answered, but I'm not sure if you've mentioned it in the PowerPoints already, but does working in Stanford or other Bay Area hospitals, or like getting a preceptorship in Stanford like give you an upper hand into getting to this residency, or is it ultimately just how you tell your experience? And yeah, so what do you guys, do you think, is that an upper hand, or is just telling how your experience is and how your clinical rotations are is what really ultimately led you in Stanford? Thank you so much.
I can help to answer that, but I don't think this would apply to you, Riley, sorry. Gabby or Daniel, did either of you have a preceptorship? I don't recall here at Stanford. Yeah, Riley or Gabby?
Yeah, I think we both did, right?
Oh,
Gabby?
okay.
Yeah. But I will say this, and please take this like, it comes from the best place. You don't need to have any experiences at Stanford. You just you could be at any hospital anywhere, but just again really dive into your experiences and really you know give your all and learn as much as you can from the experience. So is it helpful? Sure, but at the same time, I'm sure there's a ton of people who did go to Stanford for their clinicals, and they may not be in the new grad program. So just yeah, whatever resources and whatever things your school has offered you, just do your best and learn from the experience as much as possible, and that's going to help you the most.
Thanks, Daniel. Gabby, any final thoughts that Daniel didn't cover?
Yeah, there are a lot of people in the cohort who did not have any experience with Stanford or did not come from the Bay Area. So please don't let that get you down in any kind of way if you don't have that kind of experience. I think what really matters is really setting yourself apart and really highlighting what makes you unique and what makes you you and how you can contribute to Stanford. Yeah.
Thank you, Gabby. And thank you, panelists, Gabby, Daniel, Riley. Appreciate you guys so much. Appreciate your time today. Thank you to everyone here who has taken the time to stay. This recording will be available on our career site. We put that link in the chat a little while ago, but it should be there within the next week or so. We're also putting a link in the chat for some survey. We'd love to get some feedback from you. Anytime we can improve on the things that we're doing, we want to. So again, thank you so much for your time, everyone, and have a great rest of your day. See you later.
Thank you.
Thank you.
Thank you.